We're live now.
Right. I can see Claire Riley's coming in. John Warrington is coming in. Right. Okay. Welcome everybody to the Health and Wellbeing Board on today, the 12th of November. So let's go straight on. I know that everybody loves these Zoom platforms. I mean, yesterday or the day before, I think I was on from 8 o'clock till 7 o'clock. So wonderful idea, Zoom. Can't wait till it finishes. Anyway, right, here we go. Apologies for absence.
Chair, I have apologies from Jeff Watson.
Right. Minutes. Can we agree the minutes of the meeting of the 8th of October? Anything that's pressing on anybody? No, I can't see anybody. I can go there. Disclosure of members in. Ralph. You need to mute.
I just wanted to say congratulations to whoever produced the postcard that was mentioned in the last minutes. I thought it was by far the best thing we've had in terms of clarity, and everybody got it, so it wasn't dependent upon your technological capacity, and you knew that everybody was starting from the same base. It was very clear, and you could hold on to it, so it was great. Thank you very much.
Well, I think we thank Liz and Anne for that production. I don't know if anybody wants to comment on that.
Yeah, so yeah, it was my team, definitely. So thank you for that feedback. We're actually looking at updating that right now for the current restrictions. Sorry. Bearing in mind, we're not quite sure what's going to happen come the 2nd of December as well, but certainly we know that both our communities and our staff found that really helpful as well. It's really great from an engagement point of view of our Northumbrian Communities Together team are out and about, and they can use that as an aid memoir and indeed and pass that on too. So I really appreciate that feedback. Thank you.
Okay, right. Disclosure, members' interest, anybody?
No.
I cannot see anybody. Right, items for discussion. Item 4, we go to 4.1, report of the Director of Adult Social Care and Children's Services. I'll go straight over. Liz Morgan, floor's yours.
Thank you very much. Okay, so I'll assume everybody's read the report. I think one of the problems with generating a report for this meeting is that it is out of date almost as soon as it's written, and actually things have moved on quite significantly since this was written about 10 days ago.
Mm-hmm.
I think one of the most significant things is the really quite rapid escalation in the number of cases that we're seeing. So you've got there the dashboard from the 29th of October, which talks about 577 cases over the previous week and a case rate of 180.2. Well, as of today, we're now talking about, just going to look at the dashboard, 902 cases over a 7-day period and a case rate of 281.6. So that's an additional 325 cases in a week, in a period of a fortnight. Now that can only be driven by population behaviour change. So we are looking at the data, comparing the sort of epidemiology of the infection in the 900 cases that we're seeing over the last week with a week from sort of 2 or 3 weeks ago where we were seeing 550, just to see whether there are any patterns or whether it is a general increase across geography, age groups, etc. Also looking at whether we can map that to anything that might have precipitated some behaviour change. So obviously we've had a half-term period, we've had announcements about a lockdown, we've had announcements about a vaccine, and all of those things might have influenced behaviour change. But so we don't actually know whether this is going to be a blip and whether case rates will come down again, or whether we are just on a another steep rise that we saw, like the one that we saw in the middle of September. But it obviously it is a concern, because the NHS is under a reasonable amount of pressure at the moment, both in primary care and locally, and certainly across the region. There are some trusts which are experiencing acute pressure to the point where mutual aid is required. So, I think obviously the infections that we're seeing now will be translated in admissions to hospital possibly within the next couple of weeks. So we just need to be prepared for that increase in admission rates. But this increase really is quite a concern. Obviously, since the last meeting as well, we've gone into this period of lockdown. At the time, we were having ongoing discussions with the other 6 local authorities in the north of the northeast about whether we should or shouldn't move into the very high tier of restrictions. Those discussions have been paused while we're in this current lockdown period, but they are going to resume before the lockdown finishes. And I think the government's intention is that at the end of this lockdown, that 3-tier system will be reintroduced. And I think discussions will be had towards the end of November about which tier local authorities will end up in when we come out of this lockdown period. Of course, those discussions will be based on data which is potentially up to a week old. So actually, we may only have until the end of next week to demonstrate that cases are coming down to inform those discussions. So based on the rate of escalation that we're seeing at the moment, I think we're going to be struggling to stay in that high tier. And that we probably need to prepare ourselves to move into the very high tier, and I'm not quite sure how much influence we're going to be able to have over those discussions. So, from a sort of more local perspective, then, in terms of the sort of actual delivery of the plan itself, I'll just talk a little bit about testing, because up until probably a week or 10 days ago, testing had been coming down, and we'd seen quite a significant fall in tests, although it had fluctuated. Now we're seeing those testing rates go up again, which probably coincides with the increased demand from increased transmission. So we're doing about 7,500 tests a week at the moment. That's through the Pillar 2 testing process. We're opening two more local testing sites in Berwick and Hexham. So they'll start to test their first patients on Friday and Saturday, and then they will go live after those dates, and will then shift the mobile testing units to go to Alnwick and Morpeth. I think when we've analysed the data, the take up of testing in the local testing sites that we've got in Ashington and Blythe has remained quite buoyant. There was quite a sharp increase in testing uptake after those testing sites went live, which didn't result in a compensating reduction elsewhere. So it was a real increase in testing uptake, which is really good news. So we'll monitor the data on the testing uptake at Berwick and Hexham, and just look to see whether we do see a compensating reduction elsewhere, or whether we do have a genuine increase in the uptake of testing. But I think it's important that we've managed to open those testing sites, because I think providing more accessible testing to people in our more rural areas is a really important thing to do. There's been lots of talk about mass testing and the use of the lateral flow tests. What we're intending to do in the Northeast is to look at using those tests in a number of very specific circumstances. So firstly, to support care home visiting. So we'll be able to use those tests to test visitors to care homes and hopefully enable more flexibility in how that care home visiting process runs. I think the second group of individuals that we'd want to target this technology at is domiciliary care and other support staff going in to provide personal care and support to vulnerable people in their own homes. So really just to start regular testing of those members of staff. And then the final bit of the process is to do more regular testing of care home staff alongside the Pillar 2 testing, so that we can then evaluate how well this new lateral flow device works compared to the PCR testing that we've been used to. I think in terms of mass testing of whole populations, I have some reservations about the utility of that, really. I think I'd want to see the outcome of the full evaluation of the Liverpool testing pilot before we engage along those lines. I think the important thing to remember is that the use of the lateral flow devices and the test results that you get from those requires an individual to download an app onto a smartphone and then put the result into the app, and that then makes the connection with the NHS test and trace. And in view of the fact that 1 in 5 people in England don't have a smartphone, that obviously immediately excludes a significant proportion of the population from being able to take advantage of this particular process. So I think we want to see, as I said, how the Liverpool process works before we would extend this sort of test any further. And obviously we'll evaluate how it works in the settings that we've identified, and hopefully we'll have that up and running in the next, or at least ready to pilot in the next month or so. In terms of care homes, they are still the highest priority in terms of vulnerable, the vulnerable populations that we want to protect. We are seeing increasing numbers of cases in staff and residents, but actually not too many outbreaks as such. I think we are still managing a number of outbreaks in care homes, of which 3 are quite large. They are getting a tremendous amount of support from the infection prevention of control team, but I think there is always significantly more work that we can do. And I know that Annie Topping, who's leading on that bit of work, is working really hard to make sure that care homes are supported as much as we possibly can. From an educational setting, that continues to be really busy. The number of cases that we've had in children and staff increased by about 1/3 over the last week from the 7 days prior to that. Still getting some very complex queries through from those settings, which we're continuing to support from the public health team. But I think schools are managing extremely well, but I think they are under a huge amount of pressure. And then from the businesses and workplaces point of view, obviously the enforcement activity and support activity that we were doing when we were in the Tier 3 restrictions, we've sort of taken a bit of a different tack now. still trying to get our heads around actually what is the which businesses can open, which are essential, and I think businesses are exploiting, potentially able to exploit some of the loops in the regulations to stay open. I know anecdotally, when I've been into Morpeth, it still seems very busy. Still a lot of people around. Still some shops open that I wouldn't have expected to see open. But actually, I think what businesses have been managed to do over the last 6 months is to find alternative ways of operating through click and collect. And of course, those are, businesses are able to do that within the confines of the current restrictions. So that's going to be an ongoing challenge for the next few weeks. Don't think there's anything specifically that I can talk about in terms of high risk individuals and settings. And then the local resilience forum is, continues to meet every week. The strategic coordinating group meets every week. I suppose the only other thing to mention is the vaccine, COVID-19 vaccine, and where we are with that. Obviously, there are a number of candidate vaccines that are undergoing phase 3 clinical trials at the moment. And I think, the announcement that we might have a vaccine within the next, few weeks or months is obviously very welcome. But I think the point that I would get across is that, it's not going to be a silver bullet. We still don't really know whether the vaccine will reduce community transmission or the extent to which it will reduce hospital admissions or deaths, because that's not one of the clinical endpoints that the clinical trials looked at. And of course, it still has to go through what is a very robust licensing process before it gets a marketing authorization and can be distributed for use. There's a huge amount of planning going into the delivery of the COVID-19 vaccination program, and I know that the individual who's leading on that is, absolutely committed to providing a delivery process that will be as accessible and equitable as we can make it. But the sort of nature of the vaccine that we may end up with in the short term is does make the whole thing quite logistically difficult. I mean, I think the introduction of a vaccination program of this magnitude is going to be a challenge at any time, but there are some things about the vaccine that will make this a little bit more complex, if only the fact that it has to be stored at -70 degrees. So that's a sort of quick run through as to where we are with the outbreak control plan and where we're going with it. I think Anne was going to talk about comms and engagement separately, because of course we've now combined the comms and engagement board with the Health and Wellbeing board, and we'll talk about that separately. But if anybody's got any questions about anything that I've spoken about or anything in the report, then very happy to answer those.
Right. Any questions? We'll do comms, obviously, Ralph. Can you mute?
Yeah. Thanks very much for that, Liz. It's this issue of the visiting to care homes, especially people suffering from dementia. When would you expect there to be some information coming out so that people know whether they can be identified as perhaps a key worker and get this regular testing so that they can be a support for the person in the care home?
So we have just revised our care home visiting policy. So that was sent out on Monday. We were in the process of revising it anyway, because we we recognised that we needed to put in place a more compassionate approach to care home visiting that better balanced the risks of infection to care home residents to, the impact of not seeing their families and the impact that would have on their well-being. So that was already in progress. And obviously the guidance on care home visiting came out at the end of last week. So we updated it sort of quite quickly. And that was sent out on Monday, which I think gives a lot more flexibility about care home visiting and the numbers of people who can visit and the circumstances under which they can visit and how we can do that in a safe way. As regards the testing, as I said, we're planning to do that on a northeast basis, and hope to have a pilot up and running at the beginning of December. And initially that will be aimed at visitors to care homes, and then we'll look at how we can extend that to other key members of staff.
Okay, I've got Susan and then Veronica. I can't see anybody else. Susan?
Thanks, Chair. Thank you for the update as ever. I'm never quite sure where to raise things, whether they're in this report, whether they're communication, what they are. So I'm just going to say it now and then I might shut up for the rest of the meeting. It's around, yeah, don't bank on it though, Richard.
I know, I can see.
It's around the care home visiting again. I took part yesterday in a Health Watch meeting that was with family members of people in residential care and some providers actually, and some of the organisations that work with both. And it was heartbreaking listening to the experience, and this is hearing it from the family's point of view. We're not even hearing it, I would suggest, from the residents' point of view. And I really would like this council to be prioritising a solution to this that works across the sector, not just those organisations that have got enough money and enough space to put provisions in that meet the new guidelines, but to use some of our money from government for supporting communities to actually support these communities in terms of the physical arrangements, the testing, absolutely, that we need to get this testing sorted for care homes. But there's some learning out there, there's some experience, there's some shared stuff, shared good practice that we need to make sure that people talk a lot about postcode lotteries with young people and families. But I think there's one here as well, not necessarily the normal boundaries we would expect, but literally it depends where you are a resident as to whether they're going to be able to respond to these new guidance. And people won't understand that. That's the other thing, if residents are seeing that now it can happen, that puts a huge amount of pressure on, I would suggest, some of our very small independent care providers. So my plea is please, can we have this as a priority to get sorted out now?
Okay, I think all we can say is we hear that, Susan. Liz, do you want to comment, or do I go to Veronica?
Sorry, Richard, can I just ask, that money that has come from government, it's a very broad term about money to local authorities to support them. Can it be, I suppose that a direct answer to that question is, can that be used in this way to plug some of the gaps that we know are there?
I don't know that answer.
I mean, I'd need to look back on. Well, I mean, we've had sort of different pots of money, and actually, it's been quite a challenge to work out which pots of money are supposed to be supporting which areas. But I think we'd probably need to be a little bit careful about committing funding to provide infrastructure changes to care homes to facilitate care home visiting. If it requires something, a change to the building, I think we have to think quite carefully about doing that. My impression is that Is that what you're talking about? Actually changing?
No, that's not what I'm talking about. That would be, I'm talking about things like pods, outdoor spaces. I'm talking about screens, perspex screens.
Yes.
I'm
Yeah.
talking about walkie-talkies. I'm talking about quite, in
Okay.
great scheme of things, inexpensive, movable things.
Yeah. Okay. So yes. So certainly we can look at that, and I'll speak to Kath and the care homes group about how we can explore where perhaps some of the gaps are.
Right. We have got someone. I'm being asked to find out who is on the phone here. I can see a phone number and it ends 60. Can that person reveal who they actually are? Right, Andrea, I've got no response from that phone number. I'll give it one more chance. Who is on the phone ending with the phone number 60? Right, Andrea, what do we propose to do now?
Hello? Hello?
Yeah.
Sorry, I couldn't get off mute the call as the phone had muted me. My apologies. I've been trying to talk. My name's Pam Travers and I'm the Group Director for CNTW for the North locality.
Right.
Thank you, Pam.
I'm sorry, I can't join on Google Teams. It won't let me in, so I have to come in via the phone.
Okay, we just needed to identify who it was.
No, not a problem.
Okay, did you want to speak? I'm going to Councillor Jones. Councillor Jones.
Thank you, Chairman. In actual fact, I was going to speak to answer Susan's question, but Liz has said quite a lot of it. And to be honest, Susan's actually answered her own question in some ways on the suggestions that we're looking at. It's definitely a priority, Susan. I mean, you're right, it's heartbreaking. You know, you just think of your own family and think about it. But it does, and Liz has said that, and I know you're aware of it. A lot of it at the moment depends on the structure of the building and how easily the responsibility is with care homes to look at the, their risk management and how we can do it. And I think we're just going to have to look at some new ways we can do it to see how we can do it. You're right, it doesn't seem right that somebody who's in a care home that's got a path round to the back of the garden where they've got a conservatory or can put a pod and have visitors, whereas somebody that's virtually on the street can't, so we've got to look at how. The question is how we look at how, but I can assure you that it is a priority. The care homes were all given, as Liz says, because that was going to be my answer. The care homes were all given the guidance this week, and to some extent what they can do. My concern is, and I know that's what you're saying, Susan, is this business about why can they see the parents and we can't? And I've already had several of those this week, where somebody's been able to put things in place and another care home hasn't been able to. So we have to get it sorted, and it is a priority.
I think what looks for is innovation. Yes, David.
Yeah. Thank you. Just going back to what Susan said about the Health Watch Northumberland forum meeting yesterday. I've seen the initial report on that, but I'm sure Derry Nugent will pass a fuller report, Liz, to yourself and Veronica, just so you can see at first hand what people have said. And bearing in mind the conversation there with Veronica, one of the simple things was people with hearing difficulties. Quite often it was sort of one side, two sides of a window. And well, if you have hearing difficulties, that becomes virtually impossible. And I think it's a whole raft of fairly easily managed, simple solutions to get over the practical difficulties of visiting and talking and so on. So perhaps the Health Watch one, which did give some examples and also suggested things which might be done to help, would perhaps help you in these priority arrangements which you were making. So I'm sure Derry would send it, but I'll make sure it is.
Would you? Thank you very much.
I'll make sure it's sent as quickly as is possible. I'll see in a brief outline. And I'll just share what Susan said.
And I'll say again, the response, the decision is with the care homes. It has to be their decision because they are responsible, but we are working with them. Liz, I hope Liz was nodding there. I think we are working with them to see what
Right. Anybody else want to speak on this COVID? We will be going to comms later on. I can see nobody. So that's to note the report. Now I go to 4.2, population health management. Siobhan.
Thank you very much, Chair. Listening to the seriousness of the situation that the whole of the country and the world finds ourselves in, I think it's really important for us as a board to also remember that life goes on in every other spectrum as well. And that as a board, we have the Health and Wellbeing strategy, which has the 4 strands of best start in life, empowering our people and communities, working across the wider system of health and care and the wider determinants. So what I'm presenting to you today, and you've got that, all the slides in your pack, is some consideration about how we're really going to do that, building on the amazing work we already do here in Northumberland. So just as a quick recap, in Northumberland, we have a system transformation board, which is chaired by Jim Mackey and has the leaders of all of health and care providers on it, including the local authority. And that board has a responsibility in a lot of these areas to help us deliver that strategy. So what you've got in front of you today is an approach called population health management. And what I'm going to describe to you is what it is, why it matters now, especially in COVID, what opportunities it will give to our people, and how it fits in the wider changing environment of health and care. So I think the most important thing to say about it, it's very person and people centred. And what it's fundamentally trying to do is build on things like Tableau, which the local authority already has, where it links lots of data sets across a myriad of services, and link that to their care data in primary care, secondary care, and everything else that we know about people. And then from that, what we start to do is not only look at those people who are already in treatment or who already have long-term conditions, but what you do is you start to look at those who are at risk of it in the future, those emerging cohorts of people. And what's really interesting in COVID is COVID is unfortunately increasing our health inequalities and increasing some of those divisions we already have. And long COVID and that all of that sort of aftermath of COVID is affecting people as well. So what this approach is trying to do, and we've already started the work on it, is start to identify those at-risk groups. They could be in their 30s, 40s, early 50s. We'll also be looking at children and finding where we can start to intervene together in a co-designed way with people about what matters to them. So just to give you some examples of it, we did analysis of the whole population of Northumberland, and what we found was there's an incredible amount of people who have diabetes, obesity, and not only that, either depression or serious mental illness, and also those living in deprived areas and those that are socially vulnerable. And when you start to cluster some of that together, you can actually get down to the hundreds or tens or hundreds of people who are in those cohorts. And what we're going to start to do is start to sit down with those people, because we know who they are, working with them and ask them, what do they want of our system? What's going to help them and enable their lives to be better, so that they don't have to attend A&E as much, or they don't have to attend all of the services that they've got. You'll see in the slide pack, and we all know this, is that care impacts on only 20% of quality of life and healthy years of life. The other 80 is down to our socioeconomics, our environment and our behaviours. And what this programme does, it'll start to look at that. What's really important about it as well is there's some people that we know lots and lots about, but what we've got to be doing is look at areas that we know less about and find them and make sure that they get as much attention in all of this as those that we're very, very knowledgeable about in our system. And I need to say that the voluntary sector and co-designing with people is probably the fundamental part of all of this. And I know there's loads of great work going on in Northumberland. So what's different about this? I think this is going to be more systematic and coordinated across the whole system rather than just sitting within organisations. And the other thing that's different about this is you go down that pyramid of risk, and we're starting to identify and work with people much earlier in life who are at risk from certain conditions or certain environments, and try and find solutions creatively together that help that. So that in a nutshell is what we're looking at. We've got some really good help on this. In Northumberland, we've managed to get ourselves on all of the national programmes to help us work together as a system. So we've had 2 workshops so far. I've had at least 35 people from across our whole system attend those. And there's been a sign off at the System Transformation Board about this being a really high priority that tackles inequalities, but really delivers care at a person level. And the final thing I just want to say about all of this, the NHS shape may start to change over the coming years. We know that integrated care partnerships and integrated care systems are here in our environments. And what I don't want to lose is place. I think the most important work we do is here in Northumberland. We understand our population. We understand our people, and I think the future of place is going to really matter. And if we can make ourselves really strong together in the way that we understand our data, co-design solutions with our people and population, it'll put us in a really strong position to deal not only with the inequalities we already had, but the ones that are getting driven through COVID as well. Chair, I'm happy to take any questions people may have.
Right, any questions? Anybody? Ralph, you're first out the traps every time today. We need to mute.
Yeah, I'm quick. I think the stuff about the inequalities and the impact of that and getting in early is really helpful, Siobhan. It's just one thing that I had a concern about was this picture at the very beginning of what looks like a bloke going through life. Could we not find a more optimistic reflection of that? If you look at this, is the person's well and able and working for one, and then he's bent, and then he's got a walking stick, and then he's more bent than a walking stick, and then he's in a wheelchair, and then he's dead. I mean, and that's under the title Aging Well. I mean, I'm 74. I don't feel like any of those. And the whole idea of what we're doing is try to get people to feel they've got control over it. It's not inevitable, and you can do things which will make you feel and have a longer and extended life without a long period of ill health. So I just felt this was, when I saw it, I honestly did not want to read any more. I did, because I forced myself. But I think anybody looking at that would just go, it's inevitable, I give in.
Yeah, Ralph, a very good point. I take on board everything that you've said, and I'll work with our comms and engagement teams around that. Very good point. It's the absolute opposite of what we need to portray. Yeah. Thank you.
It's a very different point. David.
Thank you. Yeah, thanks for that, Ralph. I'm going to have a look at those little pictures to see which stage I'm at, and we'll take it from there. Anyway, more seriously, thanks for the report, which I think is tremendous on 2 points. One, the prevention, prior inequalities transformation, and also, your long-standing commitment to greater engagement is coming through more pragmatically as each month unfolds, which is tremendous. But could I ask, this seems a grand strategic plan, and it has a lot of merit to it. How does that tie in with lots of other strategic plans which are about or in process? is this going to oversee them? How will it link into the practical plans of other people, the hospitals and so on?
What it'll have to do, David, is all come together. So for me, this is an approach that will join all those plans together, and the acute sector, the hospitals, primary care, local authority, all in it with us. So we're going to have to find a way to use this to deliver those plans.
So this is very legitimately then the work, really in many ways, of the Health and Wellbeing Board, in
Yes.
terms of the Health and Wellbeing Board's role in integrating, bringing people together. So therefore, will progress be reported to the board? Will there be performance indicators and so on?
Yes, David. I would like this work to come back quarterly to this board. And yes, there will be indicators, and we'll be measuring impact and action. And we'll do that in a qualitative way as well, by actually asking people how things feel different for them, and if things are working for them as well.
Yeah. And within it, if I can, Richard, within it, will mental health have a priority? Because year after year, Health Watch, when it does its annual surveys, etc., mental health is a priority amongst a wide section of the population, young and old. So I presume mental health will be there.
It absolutely is, and in fact, all of the main areas that we found in terms of work are around depression, serious mental illness, social vulnerability, and people living in deprived areas. So it will have an absolute focus.
Yeah, and the final one, if I may, Richard, just in terms of the strong commitment to engagement with communities and so on, how do you actually see that playing out in practical terms? How do you seek genuine, meaningful relationship with the wider communities? Health Watch is one, but ROF's group another one. There are many, many people with whom you need to engage. What practical steps will you take to make sure that works?
I think there's layers of this, David. I'm going to bring Claire in to talk about that with me as well. But on one level, one of the things that will be different about this is those people that we identify, we're actually going to sit down with them and talk with them about what matters to them, what do they want from services, and then there'll be lots and lots of other layers as we work out to the population. Claire, can I come to you on that?
We'll have Claire. Susan, I've got you. No need to have your hand up. I've got you. So, Claire.
Cheers, Richard. David, I think you'll know over the last 6 months we've been working hard on the engagement infrastructure behind the work that we do, and it's probably worth us going through the new methodology behind the engagement plan that's gone to the System Transformation Board, because actually that talks about how it all fits together, and how really we look at that relationship that we have with the public, and how we engage them throughout any process, but also, from a population health point of view, through engaging them in their responsibility as part of their own health. And so it's probably worth us coming back and talking you through the new model of engagement that we're implementing.
David, can you mute yourself, please? There's a bit of feedback. I can only think it's from you. Right.
Why do you always pick on me for these things, Richard?
Because you're the only one on green. Everybody else is on red.
Well, all right. Well, yeah, okay. I'll do my best, Richard. I promise that.
And I'm not picking on you. It's just I can see on my screen that you're not muted and everybody else is. I'll go to Susan.
Thanks, Chair. It's a really good report, and I'm really pleased that actually it's going to be that we're going to get regular feedback on it on a quarterly basis. For me, just a couple of points. It's contained in the report, but health, that there are determinants of good health, and a good start in life sets you up right the way through. So I think, we can do all the systems and all the different working together, but unless we're tackling the inequalities that we know exist and that have been laid bare through this pandemic again, we will not achieve anything with all the reports and all the talking in the world. And one of the things that concerns me, and I think it comes into that engagement that you've talked about, is my experience, and this isn't just in Northumberland, is that those places that have the highest levels of deprivation, that have the greatest level of need in terms of health and social needs, are actually the places that are very often the worst served, but are also the places where you will not get people complaining because they don't expect any better. They don't realise there is better and that they have a right to it in the same way as some of the more vocal communities in our country. And I worry about them, and that we talk continually about engagement and hard to reach groups, but I don't think we actually really get very far in terms of doing it. And I would like that to be a real focus here, that we are speaking to those places that have the greatest need, to make sure we really are hearing their concerns and addressing them. That makes sense.
Yeah, I've got Claire.
Susan, you're absolutely spot on, and I think the way that we do that is through our stakeholders, working with third sector. But actually what we're looking at the moment, how do we engage with schools? How do we make sure that we work right from the early ages and start to engage at that point as well? So it is a point absolutely well made, and it's something that we are definitely, it's definitely part of our motivation behind the new model of engagement.
I think that's really important, Claire, working with schools, because that learning to accept and not challenge and not expect starts really, really early on. And if we're to break that cycle, we need to do it with the next generation. As a social worker, I was once accused of making kids too assertive, but I saw that as my role, for them to actually have a voice and feel confident in challenging the services that were there to support them. So yeah, thank you.
Right. Anybody else wishes to comment on this? I presume that we just have to welcome this document and note the content. And Siobhan, do you want to come back on where?
Yeah, to note the content, and that we will come back at a quarterly basis to provide feedback on progress and impact, taking into account everything that's been said about engagement as well.
Okay, happy to do so. Seems so. Right, okay, 4.3, over to Anne, communications.
Thank you, Chair. I'm just going to give members an update on where we are at the moment in terms of recent and ongoing activity. And then I'm going to take you through our campaign that we're about to launch around Northumberland Community Champions. But just to talk about the kind of recent and ongoing activity in terms of the outbreak plan, we continue to provide comms support to all the priority settings. Everyone's received the communication strategy, tactical and individual recommendations and their toolkits. Overall, it seems to be working really well, and we're really responsive. We act when we know that there's an issue, and that's working particularly well through support with our care homes and with our schools as well. We continue to work with partners and including the Trust around supporting comms around their winter campaigns. But really we're amplifying at the moment the national messaging around lockdown and what that means for Northumberland from both our residents and our businesses' point of view. So what support's available for residents, including the extended furlough scheme, isolation payments, how they can get tested, and what support is available via Northumberland Communities Together. And then of course for our businesses around what COVID safe looks like to support them to reopen safely or continue to operate in a safe way. But information on the self-employment income support scheme grant, and we're just about to step off on communications around the business support grants that were announced by the Chancellor last week. And of course our Business Hub has been operating since the other national lockdown. We're using every channel available to us to make sure that we reach every part of our community. You know, Northumberland is quite challenging in terms of its geography, so we're using everything available to us, including our kind of key partners and stakeholders as well. You know, as Liz mentioned right up at the beginning, you know, there have been a number of recent announcements, including the current national lockdown position, that they've brought a number of challenges for us. Lockdown 2 is very different from first time round. You know, people are really suffering now from pandemic fatigue, for want of a better word, but you know, they're sort of fed up with being told what to do. They're angry that they're not being allowed to see their loved ones. You know, many feel that they're doing their bit, but it does feel like some of the behaviours have changed. As Liz mentioned, you know, our town centres were busy last weekend, and I know across the LE7 footprint, from feedback from my colleagues, that's the same elsewhere. So we really need to understand why that is. I'll come on to that. From an LE7 perspective, in terms of the support that we're doing collectively, which did seem to be working when we went into local restrictions on the 18th of September. We've got an interim local campaign at the moment, which is obviously focusing on protecting the place and the people that we love, doing right by each other, and of course for the North East. I've got a radio campaign that's going live tomorrow, and I can let you hear that in a second. We have got money for a significant regional insight-led behavioural change comms and engagement campaign that really focuses on engaging with our communities to help them make conscious decisions, take positive action to keep themselves and others safe, and that will start in early December as we come out of lockdown. That is an absolutely critical piece of work in terms of us understanding why those behaviours are changed, why people don't feel they're able to follow all the guidance that's required by them, or if they feel that they have, why that's not working. So that's a crucial piece of work. We're just starting to receive some high-level feedback on that, and I'll feed that back to Health and Wellbeing Board colleagues in the next weeks or so, but that will shape what our campaign and our messaging is going forward. As part of that, we're looking to recruit some COVID community champions. I'm going to talk about that in a second. And of course, we'll continue to keep all our staff and safe and informed, making sure that they're able to deliver those critical services that our residents need, but act as kind of county ambassadors as well. So I'm going to share my screen so that I can take you through the community champions, just really high level. I just thought it might be quite helpful for you to hear some information about that. And whilst I do that, I'm going to play the radio ad that I've just talked about, which I hope you can hear.
If you're hearing this, you're in the North East. You live here, you work here, there's something or someone you love here. So while the whole country's in lockdown right now, this message is just for you. Keep going. Keep wearing your face covering. Keep washing your hands. Keep messaging your friends. Keep video calling your gran. If you keep doing all these little life-saving things, then together we'll keep slowing the spread of coronavirus. Let's do right by the people and places we love. For the latest guidance, visit your local council website. Let's do right by the North East.
So I hope everyone heard that and can see my screen as well. I can't see you now. So if somebody could just voice that they can see the screen, that would be really helpful. Fantastic. Thank you for that. So in terms of the community champions, the rationale behind that is, you know, as you know, we stood up, established Northumberland communities together that recruited over 1,000 volunteers from across Northumberland to help our efforts when the pandemic hit. We now want to mobilise those volunteers to provide a huge network across the county to share and support the range of trusted public health messages, and that's really important. I'm just going to dwell on that for a second in terms of using trusted information, because there's a plethora of information available across the media. and we know that people are sometimes confused by that messages, so we really want to major on being a kind of trusted source of information, working particularly with colleagues in the trust, which is seen as the most trusted source of information. We also reach out to our staff as well as Northumberland Communities Together volunteers and our residents, our businesses, to become our community champions. Anybody can volunteer. They don't need any specific experience or training. It doesn't require a lot of time. We just simply need their willingness to get involved and stay involved. The network of champions will help us share the kind of latest government guidance around how to stay safe, what it means for their community, for their friends and family, for their workplace, and how they can share that with others as well. And the plan is that they'll receive regular updates from us that will keep them fully informed and that they can share with others. The whole idea is that they'll pass on information and that trusted messaging to their communities, that they'll help us with a really important piece around engaging with residents so that they understand what is required of them. But that's a really important point in terms of the way that we need to develop that engagement piece. It needs to be two-way communication. It can't just be us kind of doing a kind of finger wagging, you must do this to our residents. That doesn't work. People are fed up getting told what to do anyway. It's a great way to kind of share the work that's been done in our communities as well, just to keep everyone G'd up and morale high. I don't know about you, but certainly me, my work colleagues and my family were all feeling slightly subdued at this moment in time in lockdown too. So this engagement piece will help us build trust across our communities and encourage health attitudes and hopefully behaviours. Ultimately, that's the kind of whole reason behind it, and help dispel some of those myths around COVID. Key messages, I've kind of covered a lot of this off already in terms of what we want them to do, but really we want to engage with our communities. We all need to work together to do the right thing by each other, and that radio campaign that I shared with you, that really majors on that. In terms of next steps, we had the first of our meetings with our volunteers from Bedlington last night. So the idea is that we help our community shape what these community champions look like, and actually we did get some really useful feedback from that last night, which included, so the volunteers from Bedlington, which included the local members as well, they've kind of felt that really keen to be involved. So it was a really warm response, but some worried that they might become the kind of COVID police, and that's not what we want them to be. I guess there was some worry about the amount of time that it would take them, and we don't want that. We don't want it to be a burden on anyone. But we need a full kind of army, a big network of community champions to help manage that through. In terms of next steps around that, the group last night from Bedlington are going to give us some feedback. We tested some messaging with them, so they're going to give us some feedback on that early next week, with the plan to roll that out through the kind of third week in November. We'll get all our comms set up to get ready for that, and we'll get toolkits prepared for our champions that we would send to them on a regular basis, and that they can share within their networks as well. So that's me done for now. I hope that is helpful, and I'm happy to take any questions.
Right, anybody? Guy.
Yeah, Richard. Unfortunately, I've got to jump off onto another call. I've got the Holt Whistle Academy steering project, but everything so far has been really good, and I've been really impressed with the comms so far. I mean, I've heard that on the radio and certainly on social media. I agree that there's certainly lockdown fatigue out there because, I've got shops in my area who have found those loopholes. I've got a gift shop that's selling sanitary towels and therefore claiming they're an essential shop. What do we do about that? It's legally probably nothing we can do, hence why it's called a loophole. But they might be worth a visit by someone. Yeah, just well done. And
Okay.
sorry, I'm going to jump off now.
Right.
Thanks, Gav.
Did Susan have a hand up or not?
Yeah, I did. In terms of the community champions, Anne, are you automatically involving councillors, local members in that, or do they need to volunteer?
Anne?
So they would need to volunteer, but absolutely 100% local members need to get involved in that. Indeed, the local town and parish councils will play a fundamental role in that as well. And you all are involved in all your the voluntary groups across your communities as well. You're our eyes and ears on the ground and play an absolutely critical role in the champions. So we won't automatically opt them in. They need to volunteer to do that.
Could I suggest you send an email out just inviting them to volunteer? Because I get what you're saying, you can't automatically do it. But I think some of them might think, oh, this isn't for me, this is for the community. But I'm with you, they need to be involved in this. And if we could send it to the clerks of the town and parish councils as well.
Yeah, I totally take that on board. It's actually part of the comms plan in terms of reaching out. So a dedicated briefing on the COVID champions that would go to the town and parish councils as well. Thanks for that.
David, you need to unmute, remember? Yeah, you're on the ball.
Belatedly. Anyway, thanks very much for the report, Anne. Just a comment really following on from what Susan Dunworth said before. Are you going to make a special effort to try to recruit community champions from the hard to reach groups, because they are the ones who are hard to reach and therefore the ones to whom these messages should be directed, if at all possible, in a very sensitive, positive, thoughtful way. So do you have any plans to make specific efforts to liaise with the hard to reach, the seldom heard groups, to try, if you can, to get a champion there to help spread the word to the ones to whom these messages should be directed, if at all possible?
Yeah, thanks for that, David. Yeah, absolutely. That's certainly part of the plan. And indeed, some of the areas where we're having positive cases are some of those harder to reach groups as well. They definitely need to be part of our champions community, 100%. But that also applies. So that's the young through to the old, as well as the hard to reach as well. Absolutely 100%. That's part of the plan. Yes, I'm happy to have a separate conversation with you, David, as well, just to make sure we square that all off. So we're reaching out to the group that.
If I may, Richard, yeah, that seems great. I'll pass this on to Derry Nugent, who's the project coordinator for Health Watch Northumberland, because she's
perfect. Absolutely
has much more knowledge and expertise about this area of work, which is always a priority for Health Watch Northumberland. So I'll pass the message on. I'm sure she'll contact you. Okay. Thank you.
In fact, we've actually been in touch with Derry ourselves.
One of my concerns is, as we're a week into lockdown, so we're 25% of the way, so everybody seems to think, and we probably need to start and think about, if we're going from lockdown to tier 3, I think we need to start and put that out, because people seem to have the idea that it's 2nd or 3rd of December and it's out to the shops and out to the pubs and all sorts. So I think there is a storm coming, which is Christmas. We could do with a storm to keep everybody in, I suppose, but I think we do have a problem. Students coming back, we think the spike could have had something to do with half term. Children are going to be off, family Christmases, all that. I think, we have to be prepared. You want to comment on that, Anne, or is that just so many things that we already know about?
Yeah, we're fully aware of that, and like we talked about earlier, people are acting differently at this moment in time. What we're in at the minute isn't really lockdown as we know it. As I said, it was very different from last time, really. So there's a whole set of challenges that we need to overcome. I'm working with colleagues across the LE7 to start preparing for what we might move into. But as Liz mentioned earlier, we're kind of looking to next week to see where we are on our figures. The figures are high at the minute. There's been a fairly significant increase, we think, due to half-term, Halloween, etc. So we'll look at the figures next week, and there'll be, I guess, there'll be some decisions made on what will happen post 2nd of December. We'll continue to do what we are doing in terms of amplifying that national message. In fact, I've said to my own team yesterday to really ramp that up, just to bang home that message over the next couple of days and over the weekend as well. We use trusted voices from our colleagues in the trust, but from Liz as well, in terms of, you know, the announcements for testing and vaccine as well that came out on Monday. You know, that's, of course, it's welcome news. Of course, the vaccine's welcome news, but the timing of that's some way off, and people need to continue to look after themselves and stay safe during this time. So, you know, it may be that people take the foot off the gas on that announcement, and we need to ensure that doesn't happen to try and get our numbers back down again and reduce the spread. So there's a whole number of challenges that we face at the minute, but rest assured we are trying to keep on top of it.
Okay. Anybody else on this one? It is ongoing, and it's going to be ongoing all winter, I suppose. So, right. On the agenda, we've got the forward plan. Can we agree that? Ralph, David, sorry.
Thank you. If I may, just on the annual reports, Liz, I don't know if any change of mind or change of heart, but I think it was agreed a year or two ago that the Health Watch Northumberland annual report would be presented in July. I don't know whether you still want to continue with that or not.
I mean, I think if you're happy to present it, we can bring it to the next meeting or a future meeting.
Well, I think the arrangement was it would come out in July. It's obviously a bit late for the one gone, but for next, I was thinking more of next July. If you still want,
right.
if you still
Yes,
want to be presented, then that goes on the calendar for the annual reports in July.
Yeah.
And the second thing, just there's going to be a meeting about care home quality and so on. Would I be right in thinking that, you know, the views of residents and relatives will feature significantly, their own views, their own thoughts, and their own expectations will figure largely in any meeting on care home quality, which is down on the list of meeting dates to be confirmed. Just in terms of, you know, real engagement.
Anybody?
Well, I can pick that up with Kath McAvoy-Carr, yes.
Yeah. Okay.
Thank you.
Andrea, can we confirm that comms and engagement from now on will be within the Health and Wellbeing Board? And if things take a turn for the worst, we would call it a meeting. You know, I mean, we are where we are at the moment with 800 or 900 cases, but if that doubled or trebled, we would probably have to change tack a bit. But the comms are on this meeting because we've got the same people that would be on the comms and engagement. Are we happy that that continues? And as I say, if there are any serious changes, we would convene a meeting out of the monthly cycle, if totally required. Is that okay? Ralph, did you want to speak?
Just on the work plan, is there anywhere where we're looking at child and adolescent mental health? I thought that was a specific item, but I can't see it on the work plan.
So that was supposed to appear. That's supposed to be coming to next month's meeting.
Right. Good.
Okay.
Thank you.
Right. I have no urgent business. 11:09, slightly over. So thank you all for your attendance, and we'll see you next month, if not before. Okay, thank you.